Good morning, everyone. We will start our coursework for PhD with the first topic on as to why research. And I'm sharing my screen in a moment, and we shall. Okay, so here is our topic, which is why research, and let's start off with some discussions and understanding uh, what we think about why we need to do research. Okay, so let's go about with an understanding of contemporary and ancient science, and begin with something what is being discussed currently as Ayurveda versus allopathy. Now, if everyone knows this, that recently there has been some discussions about allopathy and being people being allowed to do surgeries, and there was some discussion as to why they should not do surgery, etc. Now, why? How is research involved in this, and why are we discussing Ayurveda versus allopathy in a session on research? The reason I bring this up because some of the major complaints that people from the allopathic or modern medicine have is that allopathy is not based on research, which actually could be wrong because research is of various types, and Ayurveda is, I believe, a science which is based on a lot of observations. And Ayurveda has a lot of components such as that are related to food, daily practices, yoga, meditation, etc. If you look at current research on yoga and meditation, there's a lot of research that goes on currently, which has proven given a lot of benefits because of doing yoga or due to meditation. Similarly, allopathy also is actually observational science, but of late in the last 30, 40 years, the science or the way in which drugs or vaccines or measures to change health are utilized has changed, and the way we kind of prove it has changed. So the difference between these two systems is just that Ayurveda has used mainly observational science to derive its conclusions, and only in recent times have we seen yoga and meditation being proven by using modern research methods, statistics, sample size, etc. While allopathy also was similar, and though it's also was observational science for a long period of time, but in recent times, because it has been more more good research methods are being used to institute therapies in allopathy. So in actuality, they are not much different, but Ayurveda or benefits or the effects of Ayurveda or the medicines of Ayurveda need to be proven by using contemporary research methods or research methods. So that's one of the things that I wanted to discuss. If we actually look at nasal reconstruction, so even today when the nasal reconstruction is being done, the method is actually almost the same as was used by Sushruta in the Charaka Samhita. So this is actually ancient text, maybe 2000 or 3000, like many thousands of years old. And the nasal reconstruction that is actually being done today was copied from the streets of Pune, and it's published in a magazine called, I think, Gentleman's Magazine in something like 1800 in UK, where people learned the making of flaps from the streets of Pune, and this Ayurvedic people who were doing these surgeries were basing their techniques on the Charaka Samhita. So the point what I'm trying to say is some of the methods that I use even today in therapy are based on really ancient science. So science will remain science. The way in which we prove things keeps on changing, and we need to adapt even ancient things to newer science so as to we can confirm its utility. Chinese medicine, some of the most common medications that are used in malaria currently actually comes from Chinese herbal medicine, which was proven using modern scientific or research methods. You could also go to other topics like the flat Earth versus the round Earth. So, for a long period of time, many people believed that the Earth was flat till Galileo and others came and decided that the Earth is round. In fact, if you look at even ancient Indian texts from the various Vedas, many of them actually refer to Earth as a round Earth and not a flat Earth. Ancient Indians could estimate distances based on the positions of the stars. If you look at the recent excavations in Rakhigari in Haryana, and even close by from Karamsad, where remnants of Harappan civilization are there, about 90 kilometers from this Bhaikaka University, there is evidence of good methods of water preservation as well as buildings with good sanitation, etc. This was being used many years ago, and that again is actually science or research in some form, which does not really, which hasn't really changed much. Uh, Coming to recent times of COVID-19 and the influenza pandemic of 1918. The influenza pandemic of 1918 raged for actually quite a few years, and a lot of people across the world lost their lives. Uh, During that time, travel was not so easy, and so spread was not so easy. But in today's time, because travel is quite easy and people can move from place to place, the spread actually has been much faster than as compared to the influenza pandemic, and the fatalities might be similar. But this time around, if you look at what we have, we are much better off in terms of science in various ways, and we have actually developed a vaccine within a record time. So in the next slide, we'll look at COVID-19 and how drugs and vaccines have influenced management. So COVID-19 began somewhere in November and December in China, and scientists uploaded the genetic code of the virus onto a research system, which was then downloaded by researchers across the world. So what it tells you is that the Chinese had the capability to find out the genetic code of the virus. This is because of genome sequencing techniques, etc. Again, this is now 2019, and the genome sequencing techniques were quite recently developed, about 20 years back in 1999 to 2000, when uh, people wanted to race to code the entire genome. So it has been there for quite some time, but we have rapidly the possibilities of us trying to get a genetic sequence of any particular organism has improved dramatically. So earlier, what might have taken weeks or months can be done in hours and minutes. So our capability to develop genetic sequence of viruses has become quite actually easy. Now, because of this, genetic sequence of virus was uploaded onto computer system and was accessible to all the scientists in the world. In Germany, a test to detect COVID-19 was already available before the actual first patient of COVID-19 was diagnosed. So they did not have to import any test. They already developed a test based on the viral sequence that was uploaded on the publication. So the point what I want to make is uh, having access to good technologies and being able to develop them and to share them is an important part of science and research. Coming to something called as the recovery trial. So in the UK, the Oxford University and others, in conjunction with the government, began something what is called as the recovery trial. In recovery trial, what they did is they looked at, because when this began in February, March, and when the pandemic spread in February, March in UK, a lot of people started falling sick, and we did not have many drugs to manage COVID-19, and a lot of drugs were being used around, like hydroxychloroquine, etc. And we did not know whether they were working. So this recovery platform decided to do a randomized control trial and began testing various drugs, not only these two drugs, various other drugs, to find out whether they were effective in treating COVID-19. What they found over a period of time was hydroxychloroquine is not useful, while steroids were quite useful. If you look at the discussion across the world in March and April, many of the centers were actually not giving steroids or were discouraging the use of steroids in COVID-19, saying that it could increase mortality. But a well-conducted research trial under on the recovery platform proved that using steroids in COVID-19 a little late when there was respiratory distress or there was need for oxygen did improve mortality in COVID-19. So it was a landmark study in terms of ensuring that clinicians had some drugs at hand to improve or to prevent more deaths in COVID-19. It also proved that hydroxychloroquine was not useful. Now, there were many other studies conducted at around the same time, and which in other places proved that hydroxychloroquine was not useful. You must have also heard that hydroxychloroquine was also proven by some people as to being useful. Now it depends upon what and how the study design was done. So many of the studies which were showing that hydroxychloroquine was useful were actually just association studies and not randomized controlled trials, or they were not very well done randomized controlled trials. Similarly, other drugs like tocilizumab, becavizumab, and sarilumab were used initially empirically, thinking that they might improve mortality in COVID-19. In India, itolizumab and favipiravir were two drugs which have been used across India for COVID-19 and actually don't have very good studies to back them up as being useful. The point what I'm trying to make is a lot of these drugs are actually expensive. A course of tocilizumab can run into lakhs for a single patient. And for people who can't afford drugs or medicines, if you use a drug which is not useful, it is an unnecessary expense to the patient without any benefit for survival for that patient. This is why research becomes important, because finding out whether a drug is useful or not can actually not only improve mortality or decrease the deaths in any particular disease, but also prevent wastage of money over useless medication that are being given to patients. Okay, so now, ivermectin is another drug which has been utilized across India. Many of my residents have also received ivermectin, which is again a drug which is not proven in COVID-19. So the point what I want to try and make is research is very important, because we might end up consuming drugs which are useless and which will not only trouble us, but which will also not save us. There was something called as the plasma therapy, which became very famous in June, July, with several ministers receiving it, Delhi government making it free, and Gujarat government starting trials. But a well-conducted trial by ICMR across the country showed that using plasma therapy in COVID-19 was not really useful. Again, the point I come back to is that using various drugs in a disease to know whether it is effective or not effective, you really require to do good research. Now, we talked about drugs, and there are also vaccines that are now available. We'll skip vaccines, but then there are various kinds of vaccines which are there, and we need to know which vaccine is more effective, which vaccine can be given. And so all of these things require proper research to be done for us to understand whether this particular vaccine is going to be safe or not. But besides vaccine, we can also consider the issue of masks. Now, when everyone began in March or February, people said that masks are not really useful. But over a period of time, people said that masks should be utilized. Now, why did this change? Because they found that in Asian countries, wherever masks were being used, the number of cases of COVID-19 as well as mortality was not very high. And so people thought that using masks might be useful. And then later on, there were a lot of studies that were conducted on masks, which were in vitro, where mask was kept and viruses were sent, and they checked on the other side how many viruses passed through and cultured it, and so on and so forth. So over a period of time, it became, and then what happened? Not only mask, and which kind of mask also was then surveyed or researched upon. So the point I'm trying to make is, even something as simple as a mask or a cloth covering on the face can actually change the nature of the epidemic. So the R0, or the doubling time of a virus, or the spreading of a virus, can drop drastically or not if people or everyone started using masks. So these are important issues that are important. So again, social distancing, how much distance should be there between two people, whether it's 1 feet, 2 feet, 1 meter, 2 meter. It has to be more, whether the virus is airborne or it is a droplet transmission. So there are many questions with respect to COVID-19 which became a common topic for discussion, and hence also a topic for research. Even lockdown. So everyone knows that India went into a huge lockdown in April and May, and this not only caused the economic slowdown, but it caused many poor people to lose their livelihood. But did it really decrease the deaths, or did it not matter? If you compare Sweden did not go into lockdown, and they claimed for a long period of time that lockdown is not effective. But if you know the news recently in December and late November, Sweden also has gone into some form of a lockdown. So whether a lockdown is effective, not effective, also is a topic for research. So the point is, you can research almost anything. You could research whether quarantine is useful or not, or you could research whether isolation is useful or not. You could research whether travel bubbles, like traveling from between two places. Like there is this current cricket series going down in Australia. So people went to Australia, went into quarantine, and then groups of players who went into quarantine were tested on a daily basis. When they found all of them were negative, then they were all allowed to intermingle, and so they stayed in the same hotel. So there are this, and so that hotel and everyone in the hotel was supposed to be a bubble where no one is infected, and you could not travel out of the bubble. So there are things such as travel bubbles. So these are various public health strategies which need to be researched. You can also have a topic as to whether admission is required or not, for which patients require admission, which patients can be discharged early, which patients cannot be discharged early, and if they go home, how long should they be quarantined. You could also research what level of oxygen you need to give, which patients need to be intubated, or whether early intubation is useful or not. Because one of the earliest features in COVID-19 was in February and March to 2020 was that a lot of in patients who got intubated did not get extubated and died. So there was a general hesitancy over a period of time to intubate or delay intubation. So whether it was useful or not is also another question that could be asked. So coming to this pictures, I don't know if you can see the pictures on the screen, but there are four people. So take a minute and think about who these people are. So this is actually a person who got a Nobel Prize. All are Nobel Prize winners. This guy got a Nobel Prize for investigations and discoveries in relation to tuberculosis, Robert Koch. This is one person who discovered penicillin, so Alexander Fleming. And these two people actually won a Nobel Prize together. Okay, so and because they won together, they for the molecular structure of nucleic acids and its significance for information travel in living material. So this is Watson and Crick. So all the stuff that we know about DNA, RNA, etc., stems from the discovery of these two people. So in one way, we could look at the mRNA vaccine that Pfizer and Moderna are developing in current times is because of the background work that has been done by these two people in 1940s. Now, when you do research, you publish it. So it would be shocking for many to know that the research paper of Watson and Crick that was published, I think in Lancet or Nature or Science, one of these big journals, was actually only a half page long because the editor felt that it was not important. Okay, so the point is that what you think is important may not be considered important by the people in leadership positions today in science, but they could be completely wrong. So if you have the firm belief that what you do, what you know, or what you think is a good research question, you should continue working on that particular question. So switching gears now, how many of you have sent an SMS versus sent a telegram? How many of you have a smartphone versus booked a trunk call? The point what I'm trying to make is I am quite sure many of the people who are doing the PhD course of the 21 that I have seen, most would not have sent a telegram. I am sure no one has ever booked a trunk call because most of you are under 40 years of age and mobiles have been around, and STD phones have been around for more than 30 years or so. So it's very unlikely that if any one of you would have sent a booked a trunk call. Similarly, you could have these other things. So if you look in the left-hand side, there is tablets, CDs, DVDs, mixers, a washing machine, ballpoint pens, cinema theaters. But on the right side are things which are pretty old. Many of you may, when I show you something like that, you may not even know what it is. So some pen pal and pen friend is something of the face what Facebook we have today. Pen pal and pen friend is something what used to happen in about 40-45 years ago in cities. There used to be something called as touring talkies and gramophone and cassette player. So many of the young generation today would not know what a cassette player is. So this particular slide shows you that because research was done in various sectors, you have some of the older things have become ancient or have just disappeared. So research is something which happens in every sphere, and things keep on moving. So it's actually a hallmark of any progressive industry. So you could look at aerospace. Just about more than 120, 30 years ago, there was nothing which flew in air. But now we have spacecrafts which are not only going with going to the moon and Mars, etc. We have aircraft. So just in a space of 100 years, research has improved in such a way in the aviation sector that we have space launches. Now we have even a private company which is launching its own spacecrafts. So you must have heard of Elon Musk. Elon Musk is a scientist in the US who has his own company and which targets at launching spacecrafts on a regular basis for individuals. Okay, so you could buy a ticket on the spacecraft. So that kind of if you buy shares, his shares have shot up significantly in the last 6 months because his research is very good, and his industry is improving rapidly. So you could look at electronics such as computer science, robotics, and telecommunications. Things have changed quite significantly. Now we are in 2020. Not so long back in 2004 and 2005. Okay, so this is 15 years back. India started getting mobile phones somewhere in 1995. Okay, we had access to mobile phones somewhere in 1995, and while the West already had it since 1995 or 1990 onwards. Now what happened is in 2004 in California, in San Francisco, where the majority of the IT industry of the US is, so where the headquarters of Facebook and Google, etc. there. So at a dinner of many of these IT entrepreneurs, etc. So where all the engineers in the software space were meeting for some social function, there was one person who said, there was a discussion going on. They said, "Ki soon you will have internet on the phone." So somebody who was senior in hierarchy in the software industry said that this is a stupid concept. ऐसा हो ही नहीं सकता कि internet will be on the phone. This is just 15 or 16 years back, and you can see how today many people access internet only through the phone, and they have never ever seen a laptop or a desktop or a computer. Okay, so their main access of the internet is through a smartphone. This was unthinkable just 16 years ago. So the point is, research can and industry can progress leaps and bounds if research is one of the core areas. So this is about internet on smartphones, and this is about 2004. Somewhere in the 1980s, so 24 years before that, 1980s or 1970s, IBM was a very big company and looking at computers at that point of time. I think this was 1975, 1980. I don't remember the year, but at that point of time, IBM was a very big company, and one of the CEOs or somebody on the top management said when they were making computers, and at that point, a computer meant some big structure in a room like this or two rooms like this, and this computer was doing simple calculations like 2 plus 2 is equal to 4 or whatever. So at that point of time, somebody said to IBM that computers will be the future and there will be a lot of demand for computers, etc. So his position at that point of time is it is very unlikely that computers will be needed or required by people, and there is not a big market for computers in the world. Okay, so this was in 75-80, when actually if you see some around 84-85, uh, uh, Gates launched Windows, and around that point of time also Apple was launched, Macintosh was launched, and they changed the face of the computing industry. Somewhere in 1989-90, internet came around and became accessible to the public, and internet has changed a lot of things across the world. So the point is, this is again research. It's not health research, but again it is research, and things can change very rapidly if newer things are made available. As a doctor, as a pediatrician, uh, 30, 40 years back, if you told me that a 1 or 1.1 kg baby will get cardiac surgery done and patient will survive and become 50 years old or 60-year-old, I would not have believed it, because 1 kg baby used to not survive only, forget getting a cardiac operation done. But in 2000 and 2005, in many towns across India, 1 or 1.2 kg can get operated and can survive and can become a normal person. So the point is, things and this is all based on research. So even if you look at food industry, the common masti dahi that you get in Gujarat was not there in 2001 and 2002. You could not get packaged dahi which could last for 2 weeks, and because somebody, actually one of our patients actually was part of it, and they researched it, and they ensured that dahi was stable for a longer period of time. So now you can get masti dahi anywhere. Again, cold storage, ensuring that cold storage is there across various places allows a lot of food to be transported to interior locations. So there are many things that we don't think of many things as research, but it is a significant thing which does change life completely. Medicine, in we talked about electronics and space, etc. But if you look at these things on the screen, many of these things have actually changed medicine completely. Insulin actually was discovered by a student along with his guide. So it's not some very, you don't require to be really very senior to do good research. You need to understand the process, and you need to have an idea of, or you need to have faith that this is how something might work, and you need to have an idea for it. So the point is that many of the findings, many of the discoveries may be made by actually just students, and not really people who have gray hair like me. Uh, if you know, in mathematics, it is said in the mathematical field that if you have crossed the age of 25, you are very unlikely to make any major discovery in mathematics, because all the major discoveries in mathematics are generally made by people who are young. It is not a static thing for medicine. People who are old also can do new things. But the point, what I want to bring out, is that age is not a barrier to make to do good research and to find out new things. So HIV virus we began in 80s somewhere. It got discovered, and by 2005 there were enough drugs available to control HIV. And as of now, if somebody has HIV, it's just another disease which can be well controlled with medications, and the person getting HIV can actually live long. Okay, so it's just a space of maybe 40 years. We can't say we have cured HIV, but HIV can definitely be managed quite well if you have access to the right medicines. So laparoscopy, stents, these are all things which are the products of research. Polio eradication is again, you having a vaccine is definitely research, but polio eradication is not because just of the vaccine. It's because of how the vaccine has been distributed across populations, how you are able to communicate to people to take the vaccine, and how you are able to manage a lot of logistics supply. So again, that would be research. I talked about human genome. So human genome was sequenced at the end of the last century, around 2000, and there was a race to sequence the human genome between a private entity and a public entity. So as to who would sequence the human genome first, because that had major implications for copyright, etc. So the point is, while at that point of time sequencing a human genome was a very big task, by 2008 or 2009, even in India, even in Anand, in a veterinary research institute, there was already a genome sequencing machine which could give you the sequence of any animal that includes human beings within hours. So it wouldn't take much time. So again, that is because of very fast pace of research and innovation that we are able to do things pretty fast. Coming back to COVID-19, if you remember, in March or April, whenever you wanted to get a COVID test done, people used to get the test reports after 12 hours, 24 hours, 36 hours. Then in a few months, by July, August, we had a rapid test available where you could know your possibility of COVID-19 little less accurately, but still within like 5 minutes. So again, that is research which has made progress possible. So one of the issues with research is because it can be so overwhelming and it can change so many things. Many people who are trying to do research get intimidated. They feel कि ये तो मेरे से नहीं होगा, ये तो बहुत प्रॉब्लम है, ये तो बहुत मुश्किल है, बहुत काम करना पड़ेगा. So that is something which we need to get rid of. We want to try and do research what is feasible for us. It is definitely laborious. You have to collect a lot of data. You have to ensure that the data is correct. You could do an entire research topic, spend 2 years of your research, and find out that what you thought is going to work will not work. So it is not a failure of research. It is actually good research because you found one way not to do something. So Edison had several failures before he actually ended up making the bulb. Okay, so what we see today as success is actually a lot of hard work that goes behind it. So when you look at Sachin Tendulkar and think that he has scored so many centuries, so many runs, uh, people generally don't think the amount of time that is spent practicing his shots right from when you're 7-year-old or 8-year-old till when you're 15-year-old, and then even thereafter. So Sachin Tendulkar has been playing cricket from 7, 8 years old till around 38 years old of age, almost for 30 years, practicing on a daily basis. And so that's why he's able to execute good shots on the cricket ground. In a similar way, if you want to end up doing research, you probably would have to do it on a longer basis, and also uh, uh, know that it is likely that you might fail, and failure is not a big thing. It is just another way to not do research. One of the issues of research is if you want to do good research, you require quite a lot of funding. For example, if you want to do a nutritional intervention, then to find out whether it improves diarrhea or it improves dysentery in say patients, and you want to give some vitamins. In 2000, I remember this was calculated, the cost of doing that research was $500,000 in 2000. So today it could be maybe $5 or $6 million. Okay, so the point is, if you want to actually answer a good question, you would require a lot of money, and it is not possible to do often great research with zero funding. Okay, and again, getting grants for research is like getting a loan from a bank. Those who have enough credentials uh, will get the grant, but those who have potential but who don't have much publication or experience or research experience will not get a grant. So the point is, to reach at a place where you can do some amount of research, you need to start off small and kind of continue doing projects. So what is the need for research? So like for medical college, it could be promotions. You can be a guide to postgraduates. You can have a chance to bag prizes as national or international meets. But the most important thing would be an inner need to, or a general need to question things and improve. Okay. Also to push the nation or the state forward. So why is it important? Today, the vaccines that are available in the US. So today, everyone would know this is today is 15th of December 2020. And as of today, many people in the UK, United Kingdom, and many people in the United States of America have already started receiving COVID-19 vaccines. While we in India don't expect to get vaccines even for a month later. What is the reason for it? Because US and UK, etc., have invested in research capabilities for more than half a century or even more than that, while India has not invested money and efforts in doing research in this area for a long period of time. So we are definitely doing it, but we don't have that much amount of time that we have spent in doing research. And since we have not spent that much amount of time in doing research, as of today, we don't have the vaccine, and we will get it when they give it to us or when our vaccine becomes ready. So it is going to take some time for vaccine to get ready. This is a world output and ranking of productive countries from 1999 to 2008. If you look at United States has the highest percentage of share of papers. India is just 2%, 1.5% of the entire world. Okay, and we are still while we are still 1.56%, we are still placed 12th in the world, and Russia is actually even lower. So Russia has the Sputnik vaccine, but overall the research capability is pretty low, and research output published in productive Indian journals. Indian Pediatrics publishes more, while Indian Journal of Surgery does not publish so much. Okay. Then there are various facts like in India, as at 12th rank among countries, but with a very less share of publication. But we are improving quite a bit. And if you look at medical colleges or medical institutions, very few of them actually publish. And even those institutes which are supposed to conduct research also do not publish papers for a long period of time. Even for journals, in Indian journals are not rated very high because they do not publish quality literature, and very few of the journals that were studied were of international standard. So now we have established as to why research is to be done, what is the place of India in the research environment. So hence we know that we need to do research. So hence we need to know how to do research, how to do proper research. So the reason to do research is to so that everyday questions can receive proper answers. We can learn to formulate a research question properly. Uh, Ensure that we have a good study design, and of course, if you do a good research design, then you can get well funded. Uh, you know how to conduct research. You can analyze data, and because if you conducted good research, you can ensure that it gets published in a peer-reviewed journal. And of course, good research prevents, as I mentioned earlier, wastage of time and money. So if you establish that some drugs are good or some drugs are bad, you're not going to spend money and time in using those drugs in clinical care. And the most important reason is only good science needs to be adopted and followed. So the topic to be chosen depends upon depends upon so the purpose of the study can be thesis, which or you might want questions that need answering, or it could just be based on the area of interest. The topic can be chosen from a known area of interest or a area in which individual is strong or has prior publications, or newer areas in which publications are less and the interest is rising, such as kangaroo mother care, postpartum depression, premenstrual syndrome, pain in neonates, or simulation. Now, this is how you're going to choose topics. It should be of interest to you, or the research area should be new and should be of interest to others. So these are the basic things how you can look at doing it. Now let's discuss some known areas. So for example, malaria is something which is common, which is used everywhere, and what new can be done in malaria. So you could have a new test that is arrived for malaria, and then you can decide whether using the new test in PHCs, does it decrease malarial mortality, or whether using the test by ASHA workers improves malarial mortality. So something like that. Okay, or like for the COVID-19 tests which were there, RT-PCR takes a huge amount of technology, but tests using saliva or nasal swabs can give you reports within 15 minutes. So whether using saliva or nasal swabs in schools or colleges, does it decrease transmission? So something like that. So you can have based upon so you could pick a topic, and based upon what is new in that area, you could devise a research topic. Serum test for tuberculosis, we know that they do not improve diagnostics. Typhoid is a very common disease, but having a new test in typhoid or having a new drug in typhoid can allow you to do research in a older topic. Or even in the known areas, we could also have what are called as the Me Too studies. You look at malaria in Kerala versus malaria in Gujarat, or malaria in Gujarat in summer season versus malaria in winter season, or hypothermia therapy for neonates in India versus hypothermia in developed countries. Now, this is a significant study. Recently, the Helix trial was presented in the Hot Topics meeting in New York in December 2020. What they found was in the Helix trial, when they used therapeutic hypothermia for neonates with birth asphyxia in India, there was actually more neonatal mortality. That's what the studies showed. But similar studies in the US and Europe and in Australia, etc., have shown that when you use therapeutic hypothermia in neonates with birth asphyxia, mortality is improved. So this is something. This is actually a Me Too study, but because the population is different, you have different results. You could look at also ventilation in level 3 NICUs versus ventilation in level 2 NICUs, or ventilation in rural centers versus ventilation in urban centers, tuberculosis at various altitudes, or SARS in different seasons. So we had this thing whether COVID-19 will decrease in summer, or COVID-19 will be transmitted in hot weather conditions, etc. So there are these studies, various studies that can be done. We could also look at animal studies and devise a human study. So if you found that vitamin A levels in pregnant rats, if they are low, then the kidney size in rat pups is low. You could look at a similar study in human beings and decide whether A levels in mothers correlate with what do you say kidney size in rat pups. You could do similar studies in neonates, or same for zinc or jaundice. Again, it was shown that using room air for resuscitation in animals improved neonatal mortality in animals, and similar studies when done in human beings showed that it improved neonatal mortality in human beings. So that you can actually bring evidence from the animal literature and try and prove the same evidence in human literature. You could also begin by hypothesis and then do the initial studies in animals. That is the ethical thing to do, and then do the studies in human beings. You could choose based on one's clinical experience or practice. You can discuss issues with other researchers at various professional meetings, and you could also follow developments in literature and identify gaps in the literature. So if you're doing research work in neonatal pain, or you're doing research work in bullying, like we did. So we looked at the various literature that is published in India and abroad, and then we decided on the topics to do research in those particular areas. And because we did a good literature search, we were able to publish our studies in good journals in India. Also, discussing the same topics with a mentor in that particular area is pretty useful. Constantly being alert to new ideas and technological advances is important. So I am part of publications of what is called as a food operated neonatal resuscitator. Now I did the study and published it because I knew that it was available, and I was in touch with the innovator. Okay. Brainstorming with friends and colleagues probably gives you new ideas, and this could happen over lunch or dinner. Okay. Keep on thinking about things and reading things. You could find some new topics on Twitter itself. So we found a new topic on Twitter where, and we are currently doing it, that is based on literature review of knowledge of medical students about how to analyze journal articles. You could search information about national and global burden of disease, and also using focus groups. So focus groups are basically those people, and this is very important for health sciences. So if you want to research a topic in a particular area, you need to engage with all the stakeholders. So that would include parents or patients, and that would include nurses, So discussing with all these people as to what are the problems they face will allow you to think of an intervention or think of finding out similar problems in other areas. So using focus groups and discussions can allow you to find out the problems in a particular area. And for pinpointing the exact area of research, so you have a broader idea of what research can be done. So it's important to do a proper literature review, look at various issues. So when this room air versus oxygen for resuscitation on newborns was done, it was mainly done for preterm term babies. So then people started looking at preterm babies. Then they started looking at what concentration of oxygen should be can be done, and so on and so forth. So if you have done a study in adults, then you could do the same study in children. So, for example, if you're using uh, what are called as oral anticoagulants, NOx, oral anticoagulants, they were initially studied in adults, but you also have to conduct the same study in children. So, if somebody is not conducted it, you can do the similar study in children. But always be sure that the area that you're looking at is important enough. There's no point in doing studies which are of no use to anyone, because one, they might not get published, and even if they get published, no one is going to cite them. So it's basically research which is a waste of everyone's time, including the patients as well as yours. So clinical problem, how do you know about it? Uh, so there are not, it is not that people who do research are not interested in clinical medicine. It's actually the reverse is true. Those people who are good in clinical medicine actually turn out to be good clinical researchers, because they see the patients day in day out, and they realize what are the problems that need to be sorted out. So it's important to look at various possible options and whether one option can be better than the current practice. And we need to find out which problems occur, what are the causes that those problems occur, and whether we can sort them out. So there are various types of research. So coming to the towards the end of my presentation, we are looking at various types of research. There is what is called as the qualitative research, which includes focus groups, etc. There is what is called as the quantitative research, where you look at numbers. So you could do a cross-sectional survey, cohort study, case control study, control trial, or a randomized control trial. All this will be taught to you later. But these are two different kinds of research, and both are important. If you actually want to find out what are the main issues, what are the problems, then qualitative research is a much better way of going about it. And you could also have what is called as a mixed method studies, where you include both the elements in your research proposal. There is a hierarchy of evidence. So a randomized control trial or a meta-analysis or a systematic review is much better than a case series or a case report. But it does not mean that a case report is not important or a case series is not important. A case series is not important. So when COVID-19 was diagnosed or discovered, it was actually just a case series. Okay. So the first study that came for COVID-19 was a case series, that we saw this kind of patients and they did not respond to medication and they died or whatever. They had a problematic course. That was a case series. But 4 months down the line, you can't do case series of COVID-19 because you have seen all this already. So you would look at doing RCTs in these patients, or looking at what drugs have been useful. So the research in a particular domain uh, changes depending upon how new is the domain or how new is the topic. So in a new topic, you might end up doing case series or case reports which will get published. But as that domain becomes old, then the kind of studies that need to be done in that particular area would need to change, and you need to go to better levels of evidence. Okay. RCDs, etc., are quite easy to do as compared to cohort studies. A few slides on what is the role of the student and the guide. Okay, so the guide is actually the navigator in the rally of a car. He can direct the selection of the study, can discuss the question, give a choice of topics, discuss the study design, edit the research proposal, monitor data collection, check weekly or the monthly for the progress, solve difficulties if they arise, liaison with the statistician, help in abstract preparation, and edit the manuscript. So these are the general roles and responsibilities of a guide. So he is not supposed to teach research methodology. The student has to learn it on his own, or in whatever way it can. The guide is not supposed to write the research proposal or chase the student saying कि कब कितना काम हुआ क्या हुआ, or present the proposal or write the manuscript or present the study. So he's not supposed to do all this. He may do it, but he is not supposed to do it. Okay. The students should be conversant with research methodology. So this lecture is part of the entire series in which you will learn how to do research methodology. Should be able to do a literature search and think about possible topics. Should be able to decide on research question in conjunction with the guide. Write the proposal, present the proposal, collect the data. It is not that only the student should collect the data. Data can be collected by friends of the investigator, or you can actually employ people to collect data. That's not a problem. So not necessary that a student has to collect all the data. It is not what is implied when we mean that research is being done. Prepare the data for analysis. Know how to analyze the data. Uh, if you're a PhD student, we expect that you should be able to analyze the data on your own and prepare the abstract and write the manuscript. Definitely, you would want to ensure that you don't copy any thesis or don't do any plagiarism. I just wanted to share my experience. We have been publishing since around 2010 onwards and doing research since then. I have close to more than 250 presentations, research presentations. I'm not talking of lectures that we and my students have done, and of which at least more than 150 of these presentations are with students alone, which could be MBBS students as well as uh, postgraduate students. Uh, to my credit, I have 100 plus publications over just a period of 7 or 8 years, and but the time from research to publication can be quite varied. Some research can get published within 6 months after you finish the study. Some can take up till 6 years. It's also important to monitor the citations of what you publish. It indicates that if your research is getting cited, that means you have done important research. But your research, if it is published in a very good journal, and if it doesn't get cited, that means even though the journal you're publishing is very good, that research may not be of much use to many people. And of course, the more research you do, the more research ideas you get, the more collaborators you get, and you're able to do more and more research. So, in summary, research basically means progress. If you are not doing research on a regular basis, that means you or the institution that you work in is actually not progressing forward. There is Dr. Amdekar is a famous pediatrician, a senior pediatrician in Mumbai. I think he's 80 plus and was the president of Indian Academy of Pediatrics. He often says that if you have stopped reading for 5 years, please check your pulse because you might be actually dead. Okay, so his quote is related to reading regularly so that you keep up with literature. So, in context of research, I would put it as that if you're not doing research on a regular basis, you may be actually alive, but you're of no use to the academic community. So that's how I would put it as paraphrasing that particular line. Okay, and as long as you're doing research, you should enjoy the work that you do, as it definitely brings about change. You might think that what research you did not change anything, but it at least ensured that it did not bring the wrong change. Okay, so today, 1 year after COVID-19 was discovered, if I'm using hydroxychloroquine, then it is my ignorance and not the fault of research. But if research was not done, and if I was still using hydroxychloroquine for treating COVID-19, it would actually have been a very bad thing for the patients as well as for me. So, with that, I would like to end my class, and I hope you have enjoyed it, and we can interact tomorrow for the question and answer session. Thank you very much.